If you are a nursing student, at some point throughout nursing school, you are going to be required to do case studies. And usually, these case studies are worth anywhere from 10 to 15% of your overall grade for that course. So, if you want to learn how to ace your next case study, stick around. I'm going to be sharing some tips.
One look and I breathe.
My name is Tisha Vaughn, and I am the leading lecturer here at VHSI Nursing Academy, where we help students to ace nursing school. So let's go. The first thing your lecturer might be looking for is a comprehensive outline of the medical condition. Now, where students tend to get sidetracked is that they just focus on the medical aspect of the condition. They don't focus on the nursing management of the condition. So, nursing management is based on the presentation of the patient, so the signs and symptoms that the patient is experiencing. You have to make nursing management a part of the overview of the condition because after all, this is a nursing degree that you're doing. So don't forget to include that. So while you're going to be talking about the definition of the condition, the cause, the pathophysiology, the diagnosis in terms of how the condition is diagnosed, the treatment, and so forth, you cannot neglect to give an overview of the nursing management of the condition. All right? We're in nursing school. Don't forget that. Your teacher might also be looking at your ability to interpret data and to prioritize. In most case study assignments, you are going to be given a scenario. Sometimes the scenario is brief, sometimes it's lengthy. You must demonstrate your ability to identify key data from that scenario and then make inferences. So, this is where you're going to be examining the data presented in the scenario and then making nursing diagnoses based on that data that is presented. So, no, you will have to make the determination of which nursing diagnosis is a priority for this patient, or in most cases, you're asked to identify the top two or top three nursing diagnoses. That's a key part of your case study. Your teachers are also checking for your ability to reason. So, we're looking for clinical reasoning and the demonstration of critical thinking. And that's going to be demonstrated throughout the care plans that you create for the case scenario. So we're looking on whether or not the diagnostic statement is correct. We're looking at the goals to see if they're smart, especially whether or not you're measuring those goals, because students tend to confuse outcomes and patient objectives with goals. Goals are different. Goals can be measured by specific outcomes, and the objectives can also be there as a way to measure or indicate what the patient will do to achieve that specific goal. No, it doesn't end there. You also have to have interventions aimed at achieving the goal or goals that you wrote. It's easy to get sidetracked and just add many interventions that are related to the problem overall, but they aren't specific to the goal that you wrote, and you don't want that to happen. The interventions and rationales that you provide must be backed by recent, high quality evidence. So, you should not be submitting a care plan that you had the opportunity to sit and prepare without proper referencing. We are promoting evidence based practice. So, when you have the time to do the research, to find the applicable interventions, and to provide the scientific rationale, we expect you to also provide referencing for that. It's different when you're in the clinical space and you have a limited time to write a care plan. We don't expect you to have evidence, to justify your rationales. However, when you get an assignment, you have that time. So we need to see evidence based support for your interventions and rationales. Which brings me to my next point. We are looking for peer reviewed sources. So we want you to have scholarly articles or referencing from peer reviewed journals like nursing professional nursing journals, because these are more reliable and they add more credibility to your work. Avoid .com sources. You want the .edu, the .org, the .gov instead. Additionally, we're looking at your citation and referencing. So just check your document to ensure that you've properly cited all of your sources throughout the document, and ensure that you have a reference page where all of those sources are properly listed. These days, we're using APA 7th edition. Get familiar with it. When I am citing sources in the APA format, I literally have that tab open and I revisit it each time, because there are so many little things, little nuances to remember, and it's challenging to recall all of them. So just to be careful, and because you want to maximize your marks, you are going to be rechecking those as you go along. Your teacher is also going to be looking at the structure and overall organization of your work. It's a demonstration of the level of pride that you've taken in your work, as well as your level of professionalism. It also makes your document easier to read. And when it's easier to read, it's easier to give you a good grade. So make sure that you are maximizing your grade by ensuring that the document is properly put together. Use headings and subheadings. Stick to one font size. Maximize the use of the space. Make sure that you don't have a heading at the bottom and then the content begins on the next page. Simple things like that can go a far away. Trust me. And lastly, I need you to adhere to the word count and the page limitations that the teacher has given to you. It shows that you respect the assignment. And if you are going over the page and word limit, review your work. Look at where you can be more concise. Look at what can be simplified. Look at where you can say the same thing in fewer words. And that's it. If you have found this to be helpful, please let me know in the comments. Share it with other students who undoubtedly will have case studies to do throughout nursing school. Please let me know if this was valuable. Thank you. Don't forget to subscribe.